Hi everyone, I'm Sarah with mynaturalbabybirth.com, and I help passionate mothers who want to prepare for their natural baby births do so in a stress-free, less frustrated way so that they can give the best gift that they want to their babies, which is that of the best start in life. So, lots of words there. Before I get to today's topic, which is going to be the effects of Pitocin on your baby, make sure you go to mynaturalbabybirth.com/quiz and you can answer just a couple of questions and figure out which birthing course is going to be the best one for you, because they're not all made the same. They don't all teach the same techniques for your labor and delivery. So one method might work great for your friend and another method might work great for you, but what if you take the wrong one? We don't want to set you up for failure. We want to make sure that you have the birth that you desire and enjoy. So go to mynaturalbabybirth.com/quiz and you can figure out the best course for you. Okay? So today we are going to talk about the two bad side effects on your baby because of Pitocin. Now, Pitocin is the synthetic drug that your doctor is going to recommend or want to push on you if they want to induce your labor, if they want to stimulate contractions, if they feel like your labor isn't progressing and they want to help push it along. Pitocin is the drug that they use to do that. It is a chemical, man-made, synthetic imitation of your natural hormones of, oh my heck, I just forgot the natural hormone name. Ocytocin. Ocytocin. So oxytocin is your natural hormone that stimulates everything that is happening during your labor and delivery, your contractions, everything. And so it is thought that if you are not progressing like you should, if you're not going into labor when you should, then you need help with that. But the problem is Pitocin actually fights your body's natural ability to work. But that's more of a topic for another day. Today we are talking about what are the bad side effects that is going to, what's going to be negative on your baby. Because usually we're only thinking, oh, okay, the Pitocin is just a drug for me. I'm only going to worry about me. But actually, recent research shows that there are two things that can happen to your baby. So, number one, your baby has an increased likelihood that they're going to be in the NICU, in neonatal intensive care unit. And that could be for a variety of reasons. But basically what it means is your baby's not doing very well and your doctors have to interfere. But what this also means is that you are going to have less skin-to-skin time with your baby. So you're not going to be able to help naturally help their body temperature adjust. You're not going to be able to help naturally stabilize their blood sugar. And this leads to a difficulty nursing. If you want to breastfeed your baby, the most important time to breastfeed is right after they're born. And if they're in the NICU, hooked up to wires or who knows what, how are you going to be able to do that? It's very difficult. And depending on the staff and the situation, you may not be able to nurse your baby at all. So then later on, developing a breastfeeding and nursing habit with your baby can be really hard, and you don't want that to happen. While they're in the NICU, they can have other drugs and medications given to them for some other reason. Who knows what, depending on the situation. You are going to have a strained bonding experience, and it's going to be hard for you. And I can't imagine what it feels like to have a baby in the NICU. I've never experienced that. But all of these things we have to think about as an increased risk that can happen to your baby just because of Pitocin. Just because of Pitocin. Okay, so The second thing that can happen to your baby is they can have a low Apgar score. So an Apgar score is after your baby's born, the nurses or staff is going to kind of visually inspect your baby on a couple of different areas, and they assign your baby a score, and it's called an Apgar score based on a couple of different criteria, like their color and their grimace and their noises they're making and things like that. And on a scale of 1 to 10, 10 is like this perfectly responding baby. You hardly ever see a 10. And then 1 is essentially a baby that has passed away. And anything below a 7 is cause for concern. You want a baby with an Apgar score of 8 to 10. And so when you have Pitocin in your system, studies showed that your baby's Apgar score is more likely to be 7 or less, which is not a good sign. It means that your baby is stressed or under duress, or they may need assistance for a variety of reasons, and that leads further into possibly needing to go into the NICU or who knows what. We're not going to talk about all the what ifs, but in essence, it means that there are negative things that could still happen to your baby, even though the use of Pitocin is thought to actually help the birth along or help induce the labor and other things. But we are going to talk about 9 things that are going to help you prevent the need for Pitocin in the first place. Now, I will agree there are certain situations where using Pitocin is necessary, and you can discuss that with your doctor depending on your situation and circumstances. There are times when it's absolutely necessary, and you can weigh those checks and balances. But ultimately, our main goal, of course, is to do this naturally. So let's talk about all the things I want to help you with to prevent you needing Pitocin in the first place. Okay, number 1, talk to your doctor or midwife about wanting to avoid it. Be upfront with them. As you get closer to delivery, they may bring it up, express how you feel. You are still the ultimate decision maker in the end. You are. Do not feel pressured if you feel like it's unnecessary. So just be open with your doctor, and hopefully they will honor your wishes. Okay, the second thing is have it outlined in your birth plan. Put it on paper. Have your doctor sign it. Have copies for the nurses so that they can see it and know that you do not want your labor augmented with Pitocin and that it's something you want to avoid. Great. The next one, I kind of already mentioned this. Don't give in to the pressure of an induction if it's not medically necessary. Once you hit your due date of 40 weeks, your doctor may want to induce you, thinking, oh, you're late. But you know what? The average length of, according to Dr. Bradley, the average length of pregnancy for women, especially first-time women, is 41 weeks and 1 day. Okay? 41 weeks and 1 day. That's the average. That means there have been women that go longer and shorter. Okay? So even if you're late past 40 weeks, your baby knows when they're supposed to come. And even if you are at 42 weeks and there is nothing, if your baby's not showing signs of stress, if everything looks good, then, and if there's no medical reason to be induced, you still don't need to be induced. Your body's going to do this when it's right. So keep that in mind. You do not have to give into that pressure of an induction just because you're late. You're not late. Your baby arrives right on time. Okay, I keep getting ahead of myself. So the next thing I wanted to say was you're never technically late because your baby will come on time. Okay, if you are anxious and you want to do this as naturally as possible, you can induce your labor naturally by a couple different ways. The top 2 ways that have been shown to work are walking and sex. And so you don't need to worry about spicy foods or castor oil or all those other funny, lame, oh, it worked for me, sort of old wives' tales. The top two that work are walking and sex. And that intercourse has to be intercourse with your husband's semen touching your cervix, because the prostaglandins, I think, in his semen stimulate all the other molecules right there to get going. So, and walking. With my first boy, I wasn't even 40 weeks. I was a couple days before, and I was just so done with being pregnant that I didn't want to go back to work the next Monday, and it was a Saturday, and my due date, I think, was Monday or Tuesday, and I walked for like 4 hours that day. I walked around the whole neighborhood, and it did it, really, because I went into labor that night. Hi, sweetie. That's my son right there. Can you see him? He's the one I just talked about. Okay, then another great thing to help prevent the need for Pitocin is to keep your labor going as much as possible by moving while you're in labor. Walking, walking, walking. Changing positions in between contractions. Relaxing through the contractions if necessary. But movement is so important. You can sway on a birthing ball. The chair I'm on is actually a ball. Rocking as much as possible. Walk, 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 walk. That will help your labor progress. If you seem to be stalled a little bit and if your water hasn't broken, you can consider having your waters broken, having your amniotic sac punctured, because depending on you and your experience, it can help a lot or it can do nothing. And so breaking water for me, as soon as that happens, I transition and I'm ready and I'm there. But for some women, it can actually not help at all, not very much. So if breaking your water is something you want to do, it can help stimulate your contractions to continue on. It has worked for me, but that's something you need to talk to your doctor about. You can use essential oils for helping stimulate your labor contractions. Clary sage is excellent for this. You can mix it with a carrier oil or diffuse it in the air. Rub it down on your belly. Hi. And clary sage will help stimulate and support your contractions that way. You can get clary sage at Melaleuca for half the price of doTERRA. Go to mynaturalbabybirth.com/Melaleuca, which is MELEUCA. MELALEUCA, and check those out. And then, okay, my last tip on preventing the need for Pitocin: make sure your husband is on board, because if you're in the thick of things and your doctor says, "Oh, we need to give you a drip so that your contractions keep staying strong," and he might side with the doctor. Do you want that? Or do you want him to side with you? Do you want him to help you keep moving so that you have the birth that you want? So make sure your husband is on board with your birthing plan and he can support you and back you up in the middle of your labor. Okay, so that's everything. Before you decide if you're going to use Pitocin, make sure you're aware of these risks. And make sure to go to mynaturalbabybirth.com/quiz. And if you find out that the Confident Mother Birthing course, which is my course, is the best one for you, which is awesome, you can use this coupon, YouTube10. Enter that in and you can get 10% off of that course. Did you like this video? Give it a thumbs up or share it. Leave me any questions or comments down below, and I will talk to you later. Okay? Remember, you can do hard things. Bye.